I'm Louisa Murphy. I'm lead professional nurse advocate at University Hospitals Birmingham NHS Foundation Trust. I actually started my professional advocacy journey really before the national launch of the professional nurse advocate role in 2021. So I was fortunate during the pandemic to develop a restorative practice role within critical care services where I'd worked for over 20 years. It had already been identified that staff were under a lot of pressure and that stress was having a major impact on staff. And coincidentally, I started that role just as we went into the pandemic. So I was able to develop that role into a professional advocacy role. I was very much supported by the professional midwifery advocates in the trust, and I was able to help and support a lot of staff that were experiencing a very difficult time in their critical care careers. I was really fortunate then in 22 that a lead PNA role came up within the organisation, and I took that role to build on what I'd done in critical care really and try and implement and promote the role across the organisation as a whole. We've got 20,000 staff in the trust, and of those we've got around 6,000 nursing staff. So building the PNA community is something that I'm really passionate about. In terms of the impact and value that PNAs are having across University Hospitals Birmingham, we've got 60 qualified now of 6,000 nurses. So at the moment we're sitting at about 1 in 100 in terms of ratio of PNAs to registered nurses. Most of the PNAs within our organisation at the moment are developing their PNA roles alongside their substantive posts, and as a result of that, some are able to do more than others depending on their workload during the month. Having said that, they're having a major impact on the staff that they're engaging with. In the data that I'm collecting, we've seen that the range of staff that are engaging with PNAs is quite wide. It's not just nursing staff that are engaging with PNAs. We've got admin staff, we've got facilities staff, medical staff, midwives. We've got a whole range of staff that are engaging with our professional nurse advocates, and they're talking to those staff about a range of topics. So stress is a big factor, but not just stress in the workplace, also stress at home as well. That's featuring quite a lot in the conversations that our PNAs are having. Career planning is another really important topic that staff are engaging with PNAs about, and that's having a big impact because our PNAs are helping to retain staff within the organisation by sort of talking through with them what their options might be in terms of future career development. I'm quite fortunate in that my role at the moment sits under education, so I engage quite a lot with our clinical educator PNAs. So they're doing an awful lot of work at the moment with particular staff groups. So we've got PNAs that look after our international recruits, we've got PNAs that look after our preceptor students and qualified nurses. We've got PNAs that look after our healthcare support workers as well. So there's quite a lot of staff groups that our PNAs are engaging with, and they're talking to them about a wide range of topics. I've talked a little bit about education. They're often talking to staff about financial concerns, about safeguarding concerns for themselves as well as patients, and about the patient experience as well and how they can improve things for the patients that they look after. Cost of living is another topic that's coming up quite a lot in the signposting that PNAs are offering to our colleagues. some of the QI projects that our PNAs have worked on within University Hospitals Birmingham has had quite a big impact as well. So we've had QI projects around safety huddles, about improving handover, guideline drafting, communication boards, nurse-led discharges, how to escalate concerns within an area, wellbeing surveys. So there's a whole range of QI projects that our PNAs have engaged in and help support staff with, and that's while they're doing the role alongside their everyday jobs. I started my professional advocate journey at University Hospitals Birmingham before the national rollout of the professional nurse advocate role. Within that time in critical care, I developed a really close relationship with the professional midwifery advocates within our organisation. They were already using the AQUIP model really effectively, and they'd built a first-class service of support for their staff that was having a massive impact on patient care as well. So for me, I think the important thing about implementing and embedding the PNA role was to have that sort of peer support really from colleagues that had already done the same in their own specialities. And I think identifying the key stakeholders as well was also really important for me. So our senior nursing team within the organisation, making sure that they were aware of what the PNA role could do for their teams, engaging with the chief nurse, the deputy chief nurse, and those senior nursing managers within the organisation, just to sort of talk to them and show them how the professional nurse advocate role could support them and their teams. And I think, you know, stressing to them that the support was there for them as well, not just for their colleagues, but also for our nursing community across the organisation. The other important thing for me as well was to grow our PNA numbers. So initially when I began the PNA lead role at University Hospitals Birmingham, we hadn't got PNAs in every division within our organisation. So at the time we'd got 7 divisions, which obviously broke down into different sort of speciality groups and clinical service lead groups. So I've been able to build the numbers so that we've got PNAs in every division within the trust now, including within our community nursing team as well. So I think growing the numbers was really important, and engaging with the PNAs about what they wanted within the role. Talking to them on away days about how we could put together a procedure document so that we all had the same kind of guidance to help support us in the roles that we do within the organisation. I've also recently done a business case just to see how we can go forward with the PNA community within the trust. It's often quite difficult for PNAs to have protected time to develop their roles within their areas, and particularly those patient-facing PNAs are finding it quite difficult to free up time to support colleagues and work on quality improvement initiatives. So my vision is going to be having a small full-time team that can support PNAs within their areas to help them to develop their roles. So I've just done a business case to support that as well. I think the important thing as well has been to engage with PNAs as much as possible. We're a big trust. We've got 6,000 nursing staff. We've got 20,000 staff in total working across the organisation, and PNAs aren't just speaking to nurses, they're speaking to a wide range of staff within our organisation. So I think checking in with our PNAs, we've got a community of practice meeting that we have every 6 weeks just to share what we're doing and to learn from each other. There's a Friday meeting that I organise for student PNAs to sort of drop into if they've got any support that they need with the course that they're doing. And I think engaging with PNAs on away days as well. And I think the important thing has been making sure that we've got some supervision for the PNAs within the organisation. So one of our colleagues within the Birmingham and Solihull Mental Health Foundation Trust has actually offered to do some monthly supervision for our PNAs as well. And I think massively important for me has been networking. So not just networking within the organisation with key stakeholders, with PNAs, with the staff that are engaging with PNAs, but also engaging with PNA colleagues regionally and nationally as well, and learning a lot from each other. So it's a work in progress, definitely, but I think those particular things have really helped me from the get-go. I think for sustainability, what I'd really like is to have a core PNA team within the organisation that can help to develop and support PNAs and the work that they're doing in their individual areas. So I think going forward, I think we definitely need a core team to support the work that we're doing. And building on that, I think making sure that we're continuing to train professional nurse advocates. So whether that's something we can do in-house at some point further down the line, because we have got a school of nursing within University Hospitals Birmingham. So whether that's something we can look at doing ourselves in the future, or whether we can continue to commission professional advocacy training with some of the HEIs that we've got available to us. The important thing as well, I think, is to make sure that we're continuing to develop our PNAs. So looking at how we can continually develop, offer additional training to PNAs so that they feel well equipped to do the role that they're doing in supporting staff and patients. And the other thing that we're looking at as well is, and actually we've got some colleagues doing their training this September, is opening training up to allied health professionals as well, because every time I seek expressions of interest from nursing colleagues to undergo training with a national programme, I have many AHPs that want to do the training as well. So we've actually been able to get funding to facilitate that this September. So as well as growing our professional nurse advocate community, it's about growing our professional advocate community in general. So whether that's midwives, allied health professionals or nurses, I think we need to sustain that advocacy by training more colleagues to do the role. Most importantly is just to continue that networking as well, and reaching out to colleagues within the region and across the country that are doing some amazing work. Everybody's willing to share what they're doing, and I think we're learning an awful lot from each other. So I think going forward, it's about maintaining that PNA community so that in our own individual trusts we can continue to sustain the momentum once the national funding has come to an end. For me, I think advice to anybody that's coming new into the lead professional nurse advocate role, I would say look at what's around you, look at who you can engage with, who have you got within your organisation that can support you in building your PNA community. For me, I learned a lot and I had a lot of support from professional midwifery advocates within the trust. They'd already got a really excellent service using the AEQUIP model to support midwives. So they gave me a lot of support in developing that for our nursing colleagues. I think the important thing as well is also to collect as much data as you can. So building up a picture of what you're doing, what the PNAs are doing within your organisation, and using that really to strengthen the argument you might have for a full-time team or for protected hours for the PNAs that you've got. So, you know, what are your PNAs doing? What are they achieving? How many missed opportunities have they had because they haven't got the time always to do PNA activity alongside their substantive role? And I think the biggest thing is the networking, peer support, whether it's within your organisation or across the region or nationally. And again, the Future NHS platform has been really useful for just keeping those conversations going. So even if you haven't got anybody within your organisation that you can link in with, I would say go on Future NHS platform within the PNA workspace. There's a whole community there that can help support you and give you a leg up really in what you want to try and do in your own trust. I think for me, I think the biggest thing has been, I think the networking is really important. I think, you know, Twitter has been really important to the PNA community and Future NHS platform. So I think they stand out quite a lot for me, really, in terms of how you can, you know, develop a community and share resources and just help support each other.